Do you have pain that's radiating down into your shoulder and sometimes back into the shoulder blade? If this is you, keep watching to the end because I'm going to teach you about this sneaky little muscle that quite often causes this type of pain. And the best part about it is it's really easy to treat. So here's the problem. This is something that people describe to us really, really often. They come in saying that the pain is aching down in the shoulder and down in the shoulder blade. Sometimes it sort of twings a little bit when they turn their neck, but it certainly hurts to sort of lift the shoulder and move it around. They've tried everything to try and stretch it out and move it and loosen it up, but it just doesn't go away. It stays there, or it might temporarily relieve just through here, but they can still feel it sort of pushing down into the shoulder. If this is you, keep watching because it's quite often this sneaky little muscle that people don't expect. So here it is. So the muscle's called your scalenes. So this is a little picture. Hopefully you can see this okay. But these are the muscles here. They're actually little neck muscles. So they go from your little neck joints up here and they dive down onto the first rib, down into the rib cage. And when you have knots in these muscles, you often feel it in all these red shaded dotty areas through here. So typically people feel it most through the outside of the shoulder and the upper arm. Some can feel it a little bit in the chest. And then a lot of people describe this in between the shoulder blades. Worst case scenarios, and this is not all the time, but worst case, it can even go all the way down to the thumb and the forefinger. So scalene muscles, they're a little bugger of a muscle, and it's really, really common that they are the issue with shoulder pain, and something that's missed quite a lot. So if you're having this problem, the great thing is that it's really, really easy to treat. And it's actually pretty funny because we get the patient on the bed and we start pushing into these muscles in the neck. And their first thought is, you can see it in their eyes, is, why are you pushing in my neck? The problem's in my shoulder. What are you pushing in there for? But when you get your thumb onto those scalene muscles to release them, holy moly, do they feel it referring exactly down into where their pain is. We hold it for 20 to 30 seconds and do a couple of other techniques to help the joints underneath. And often it resolves pretty quickly with only a couple of sessions. So if you are having this problem or you think you might be having this problem, send us a message. We can help work out if this is something that we would want to treat for you. The reason that I've brought this up is often when people get this pain down here, they think one of two things. Either that's just how I am and I'm going to live with it, which is terrible because nobody wants to be in pain constantly all the time. The second thing that really worries them is, oh, I've got a pinched nerve, or it's nerve pain, or I've got nerve damage, which is the worst case scenario. So, you know, often I've had people come in after months and months of thinking that their nerves are not working properly, and they've stressed and stressed and stressed about it at home, and only then have they come in. So I just wanted to let everybody know that it may not be nerve pain. It might be as simple as a muscle up in your neck. So if you are having troubles with it, just come and see us or send us a message and we'll be able to help you out. All right. Thanks for watching, everyone. See you later. Bye.